In the world of skin cancer, melanoma is the most dangerous form. Basal cell carcinoma is the most common. Squamous cell carcinoma, which develops in the thin, flat squamous cells that make up the outer layer of the skin, isn't the most at prevalence or mortality, but it is still quite common and can be very aggressive.
Squamous cell cancers, on the other hand, can be more dangerous than basal cell cancers in that a subset of them can be quite aggressive and metastasize or travel throughout the body the way a melanoma can. And in certain instances, squamous cell cancers of the skin can be lethal. The vast majority, however, are not and can be completely cured with proper therapy.
Exposure to UV rays is the #1 risk factor. Squamous cell carcinomas are usually the result of an accumulative or lifetime exposure. So people who live, work, or play a lot outdoors are more likely to develop squamous cell carcinoma than other types of skin cancer. Men are 3 times as likely to develop squamous cell carcinoma than women. Smokers are also more likely to develop it, particularly on the lip.
They present in a similar fashion in a similar type of patient, such as someone with fair complexion, light eyes, fair skin, light hair, who's had lots of sunburns or sun exposure during their life, and they also occur most commonly in sun-exposed regions such as the face, scalp, or tops of the hands. They present a little bit differently than basal cell cancers in that typically they look like a crust or a scab that doesn't typically heal.
Though squamous cell carcinoma most often occurs on sun-exposed skin, it can occur anywhere on the body, including inside your mouth and the genital area. Squamous cell carcinomas often look like scaly red patches, open sores, or elevated growths. They may have a crust or bleed. If you're diligent about your skin health and notice anything like this, you may be lucky enough to catch squamous cell carcinoma in its precancerous form.
The precancer form of a squamous cell is something called an actinic or solar keratosis, which usually starts out as what the patient perceives as a dry spot that persists and doesn't heal. And these are most common in sun-exposed regions, such as the face, scalp, ears, or tops of the hands. These lesions typically are thin. You usually cannot feel them raised above the surface of the skin, but they feel like a persistent dry patch or crust and sometimes are uncomfortable.
A dermatologist will first diagnose squamous cell carcinoma with a physical examination and then a biopsy. Once a diagnosis is made, the dermatologist will determine the best course of treatment, which will be based on many factors, including the cancer's type, size, and location.
So another common form of treatment for skin cancers, mostly basal cell and squamous cell cancers, include something called an EDNC, which stands for electrodesiccation and curettage. It's a relatively quick in-office procedure performed under local anesthetic, where the patient is anesthetized and the tumor is essentially scraped or curetted off the surface of the skin. The procedure is very, very quick, relatively safe, has very, very limited, if no downtime whatsoever.
Other treatment options include laser therapy, which has a reduced risk of bleeding, swelling, and scarring, and is therefore an option for very superficial growths. Radiation therapy uses high-energy beams to kill cancer cells. It's an option for deeper tumors or for patients who cannot have surgery.
These days, there are other options for skin cancers, which include topical chemotherapy creams or medications that can actually medically clear the roots or the cells that are abnormal. Again, used more for basal cell and squamous cell cancers in certain situations. The last form of treatment is liquid nitrogen therapy, or what's called cryosurgery, where liquid nitrogen gas is essentially frozen onto the skin to burn the surface and roots of the tissue to cause what's called a crust, and then the crust peels off, hopefully with the roots of the cancer involved. A relatively quick, safe, easy procedure.
You can try to prevent squamous cell carcinoma. Wear sunscreen, preferably with a broad spectrum of UV protection. Wear protective clothing. Wear a hat that provides shade. Seek shade during the peak sun hours between approximately 10 a.m. and 2 or 3 p.m. Self-examinations at home will make you more comfortable with the appearance of your skin so you can spot changes immediately. Squamous cell carcinoma isn't most, but you can be most vigilant or most likely to stop skin cancer before it even starts. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.